become part or form normally part of their everyday experience, and then we would be tackling directly substances. So really what is prevention depends who you are targeting it to. And I will give you a few examples soon. But the most common form of prevention that is happening globally across the world is targeting young people during the teenage years. And there is a good rationale for this, because drug use really is a developmental problem, and most of the drug use is happening between, let's say, the age of 13, 15 and 22, 3, something like that. And there are many also biological and brain developmental reasons for this, why both initiation as well as the occurrence of disorders happen during these ages. And well, we have basically then two learnings from this picture, and one of the learnings is that when we speak about prevention, we don't only want to prevent all drug use, but we also want to delay the initiation, because if we are able to support a young person to reach the age of 20, 22, 23, so that they have not started to use substances, the likelihood that they will start to use substances later is actually getting really, really small, and moreover, the likelihood that they will develop disorders or other problems related to substance use is also getting really small. So in reality, we want to both prevent initiation and delay initiation, which will both contribute then to also preventing drug use related disorders. But as I said earlier, prevention is not only targeting this age group, and often it's much more effective to target the younger ages before the initiation, so that we can really impact the developmental trajectories in more fundamental way and prevent this experimentation from ever happening. And so since we are not only targeting substance use behavior as such, but want to contribute in a broader sense to the healthy and safe development of children and youth with prevention, we really want to target the risk and protective factors that are underlying substance use and making some people more vulnerable to some substance use than others. And here are just few examples of all those factors contributing to substance use that our prevention interventions, including within educational settings, are then targeting. And it's pretty much non-comprehensible picture, because there is too much information there, and that is also one of my points with this slide. It is complicated, and it's much more than just providing information on prevention. But then, in the other hand, once we are really able to effectively influence these complex set of factors that will influence the development of individuals in different ways, within different stages in life, during different developmental periods, we are able to really influence the entire developmental trajectories, like I said earlier. And it logically follows that with prevention of drug use, we are also able to prevent many types of other risky behaviors, and the interventions and policies we support have good evidence of preventing, for example, violent behavior or risky sexual behavior, depending on the type of intervention. But moreover, we have also good evidence of many of our drug prevention interventions preventing, for example, truancy or school dropout, and supporting school attainment and classroom behavior, and even academic achievements in more long term. And so it logically follows that prevention can really be a gateway to achieve better schools, and to achieve, for example, better job satisfaction of teachers, better learning outcomes, and better school climates, and so on. which is one key reason why educational settings are so important for drug use prevention. But then you can also look it other way around and see that education in itself is a crucial protective factor preventing later substance use. And just having access to education will make a big difference in protecting children from risky behaviors. And so this is the rationale why education is such an important setting for us coming from prevention field, but also why for those working within schools and within education setting, prevention of drug use can offer many benefits also beyond preventing substance use. And we have quite a broad evidence base by now showing us what type of concrete interventions and policies really do contribute to all these positive outcomes and really impact all those risk and protective factors. And I will give you a few examples, and they are all listed on our International Standards on Drug Use Prevention that we published a couple of years ago, soon almost 5 years ago, that provide a menu of interventions and policies that have evidence on preventing substance use. And this is one of the key documents upon which the new guidance documents that we produced with UNESCO and WHO was based upon. And so then let's look into these examples. If we, for example, start from the childhood, when it's crucial, first of all, to develop a safe attachment to the caregiver, but then after that to start to learn to regulate your own emotions, your own behavior, and then gradually to start building on the very first basic numeracy and literacy skills and social skills on that. And this is a period when prevention can do a lot in impacting all those things and supporting healthy and successful development of children. And one example is just facilitating the access of children living in poor or high-risk neighborhoods into early childhood education, which basically means structured kindergarten possibilities and structured daycare that will provide a safe setting for children to start learning those early social skills and very basic early literacy skills and communication skills and numeracy skills. And this study, for example, that comes from Northern America, showed that when you look into these kids who had access to good quality early childhood education coming from high-risk communities, when they turned 21, they had much smaller likelihood of using marijuana or being a teenage parent or be enrolled in college or university. So this is one very nice example of the nice and positive outcomes also when it comes to further educational attainment that drug prevention activities can achieve. Moving then on to middle childhood and looking for a few examples during this age period when besides the family also peers become increasingly important socialization agents and settings for prevention and when children really enter school and when the most important developmental goals include learning more sophisticated social skills, self-regulation skills, and academic numeracy and literacy skills. And in this age, school really is key for safe and healthy development. And one nice example of a good prevention strategy for this age period is classroom environment programs. And these are the type of programs that aim to provide simple to use tools for teachers to really focus their attention into positive behavior and into rewarding positive behavior, and while also giving them a structured and effective way to deal with and respond to inappropriate behavior with active engagement of children in the process. And these programs have very nice prevention outcomes as well. And in practice, they might look like this. This is an example of good behavior game. And it's a game that teachers typically play during the first school year. And they start by making a simple set of rules together with the children. And after that, they divide the class into small teams that will then compete against each other in behaving according to these rules, and the teacher will reward them. And first they play, let's say, only 5 minutes at a time, and the teacher will give them concrete rewards like stickers or pens. But increasingly during the year, they start to play longer and longer periods of time, and also teacher is not anymore giving them concrete rewards, but just giving points to, for example, on a chart like you see here on the picture. And what then happens? If we look into the children who played this game during the first school year, during the normal teaching, so this program doesn't really interfere with the normal curriculum, but it is played during the teaching of the normal curriculum. What will happen when these kids are adults? Here we have results from, again, from Northern America, looking into especially the vulnerable subset of population of boys who showed signs of early aggressive behavior during the first school year. So when we look what happens to these boys when they reach the age of 21, out of the control group, 80% is suffering from drug dependency disorders, 40% is smoking, and half of the boys in this subpopulation who had shown early signs of aggressive behavior showed violent or criminal behavior. But when we look into the children who played this game during the first school year, you will see that only 30% of them had drug dependency disorders, none of them smoked, and only a bit more than 30% of them showed or had a record of violent or criminal behavior. And this is really a huge impact if you think it also in terms of savings of tax money paid services in healthcare or in social care or in criminal justice. And furthermore, looking into the educational outcomes out of those boys who were at high risk in the first grade but who played this game during the first school year, 75% were graduating from high school or had graduated from high school when they turned 21. And this is another very nice result to show to your education sector stakeholders when rationalizing why it really pays off to invest in rigorous evidence-based prevention. And then I also wanted to show one other example for this age group of middle childhood, which is policies to keep children in schools, which is what I already mentioned in the beginning, but I think this is something really important and also something that at least our stakeholders do not always have in mind when they think about prevention. And we have very good indications that, for example, providing conditional cash transfers or supporting school infrastructure or, for example, nutrition in schools is also contributing into substance use prevention later on. And then we come to early adolescence, which, as I mentioned, is the most popular age group for prevention, normally in the countries where we work with across the globe. And this makes sense, since this is the age when substance use behavior normally begins, and children and young people start experimenting with risky behaviors in general, because it is the age when they start to normally experiment with new social roles even more broadly, and they are slowly gaining independence. And one additional thing that explains why there is so much risky behavior happening in this age group is the physical development in the brains also that makes the emotional reactivity of teenagers higher than what it is during other ages and times, while at the same time the cognitive regulation systems that we often call the prefrontal cortex, which is the part of the brain that really regulates the behavior and is able to think of future consequences, is not yet mature. So they have immature cognitive regulation, because those functions normally only mature around the ages of 23, 24, 25, while at the same time the emotional reactivity is really high. And this is on your average kid, but then when you think of those young people who have difficult personality traits, or who have, for example, sensation-seeking behavior, or who have some kind of difficulties in controlling emotions, or especially high stress reactivity, you can imagine that at this age the problems normally start to show off also to the people around them, and manifest in, for example, in substance use behaviors. So the most popular type of prevention that our member states report to us year after year when we ask them what type of prevention they are doing in their countries is prevention education targeting children during the teenage years. And it is supported by evidence, and we have some very good evidence showing how effective it can be and what positive outcomes it can have for substance use behaviors and for other outcomes as well. But at the same time, we have also evidence that there is a lot of prevention education going on that is not really effective, even if it's prevention education that is evaluated for effectiveness. We have quite a few studies showing that the programs did not have impact at all. And that is why it's so important to look into what really happens during these prevention intervention programs and prevention education programs. And in general, when we talk about prevention education, it's always, all effective programs are always based on building skills. They are interactives. They are delivered via a series of structured sessions, and they are always delivered by well-trained facilitators, whether external facilitators or teachers or peers, and they provide plenty of opportunities to practice a wide variety of personal and social skills. And of course, these skills will then depend, and the ways to practice these skills will then depend on the targeted age group. And okay, sorry, I'm just hearing some echo now, but I will just go on. So, for example, coping with stress and negative emotions, learning how to make decisions, learning basic resistance skills, and so on. But especially after the age of initiation, when young people start to encounter substance use related situations in their life, it's important to practice these skills also in the context of substance use related situations. So, for example, resistance skills might be practiced within role plays about somebody offering substances to a young person, and so on. And it's important also to try and change the risk perceptions and give young people more accurate perceptions of what kind of consequences might be related into substance use, while emphasizing especially the short-term consequences, because, as I said, the parts of brain that are responsible for also for planning future and thinking in long term are not yet fully developed, and that's one reason why it's often not so easy for them to really think about the long-term consequences, but short-term consequences have shown to be much more important. And furthermore, we have some good evidence showing that it's important to discuss how normal it is in reality to use substances, because young people tend to overestimate greatly the amount of their peers that are using substances. And by critically also discussing the social expectations and norms and values will help the young people to make their own decisions and to navigate in middle of these expectations and social norms. And as I said, with this type of interventions, like with other types of interventions as well, we also have evidence showing us what does not work. And for this intervention, I wanted to show you an example. And the characteristics of interventions for prevention education that are consistently associated with no outcomes or even with negative outcomes, with, for example, increased experimentation with substance use, include giving only information in non-interactive way, especially when it involves fear arousal techniques. It can be very harmful, and it can even increase stigmatization and alienate those young people who have already encountered substance use, or make them even more vulnerable when they are stigmatized further, which will further increase their likelihood to progress into more harmful patterns of use. But also,
Hanna, Hanna, you have maximum 5 more minutes left, just to let you know.
Yeah, thank you. More or less to the end. And also, using ex-drug users is not effective. And here is one example called Unplugged that is delivered over 12 sessions. And 3 of the sessions deal with substance use, and other lessons deal with decision making and social pressures and other important issues. And the lessons include concrete coping skills. For example, here they are taught this one particular strategy of solving problems over 5-step process that they can apply to different contexts. And here are some examples of results that we got from Brazil, where we were implementing this program among 5,000 students, and it had a very nice impact immediately after the program end on alcohol use, inhalant use, as well as on cannabis use. And then finally, during later adolescence and adulthood, prevention is still important. And a few things that have shown to work nicely in colleges and universities are establishing clear policies on substance use, as well as offering broad healthcare services, and especially screening and brief intervention, and immediate counseling and referral to further services. And these healthcare-based interventions are one important component of the guidance that Yongfeng will soon introduce. And as schools are such a well-regarded institution in most of the communities, they are also excellent way to reach other sectors of society and other community stakeholders. And as one example, parenting skill programs are often implemented in the context of school. And they are one of the best researched and most effective types of prevention programs. And they are programs that basically bring together families for over a number of sessions, from 5 to 10 normally, to practice concrete parenting skills like monitoring and establishing positive and developmentally appropriate and consistent discipline, and on providing positive attention to the children. And we have a very good outcomes on substance use, on violent behavior, and on other outcomes on these programs. And as I said, they are often also implemented in school settings, because schools are often a very natural point to bring families together in communities. And leading up to the issues that Yongfeng will discuss about how to then scale up all these examples of prevention at national level and really make them happen at a bit more large scale. Here is an example from Serbia, where the Ministry of Education decided to establish a training for one of these parenting skill programs as part of the mandatory continuing education for teachers, because they saw that these programs carry such a high additional value also for schools and education setting. And so I gave you some examples, but this is the full menu of evidence-based interventions and policies that we provide in our standards, and most of those can be delivered within education settings. And so there are very many very good tools at our hands that we can use in order to support the healthy and safe development of children and youth. And to sum up, during the 1 minute I see I have left, I just wanted to emphasize that schools are indeed one of the most powerful socialization agents, and as such a very important setting for prevention across countries, across cultures. And effective ways of prevention, as you probably noticed from these examples, do not focus on substance use behaviors as such or on information related to substance use, but they aim to support the healthy development in a more broad and comprehensive manner. And many of these programs have shown to yield very good cost benefit and savings in later healthcare or criminal justice or social care related costs. But this only holds true as long as you are actually implementing effective prevention, because unfortunately there are also many prevention initiatives happening in the world that are not so effective, and that's why it's really important to be looking into what we already know and let that inform the existing prevention practices and benefit from that, so that ultimately also within schools we would be able to bring all the actors together for supporting the healthy and safe development of children and youth. Thank you. Now I let Yongfeng to continue from here.
Thank you very much, Hanna. We just made it in time, a little bit over, so let's be introducing our next speaker. Thank you, Hanna, again, for this really informative presentation. Our next speaker is Yongfeng. He is a program specialist at the Educational, Scientific and Cultural Organization, UNESCO in Paris. Before joining UNESCO, programs and projects for family planning and adolescent reproductive health in China. I'm sorry, I think that my audio is poor, but I'm actually handing over to Yongfeng, so I hope his audio is fine. And please, if you haven't done so, write into the chat box your name and where you're from and any questions that you have.
Okay, thank you very much, Caroline, for your very nice introduction. And can you hear me?
I can hear you fine.
Okay, so I'm taking over the presenter role. So my presentation will be much shorter and just trying to flag some of the issues related to the implementation of the evidence-based responses to substance use, as Hanna just presented, within the context of the education sector. So as you have just heard what Hanna just presented, there is a lot of scientific evidence already available on on education policies and school-based programs that are found to be effective to prevent substance use and to prevent the negative consequences of substance use, which are very much well documented in the UNODC international standards Hanna just shown us. However, as many of you may know, the sustained and scaled up implementation of such evidence-based programs and policies still remain very low and unequally spread globally. And we could hardly find, if there are many countries really have, there are very good best practice everywhere, almost in many of the countries, but it's more difficult to find the examples of countries where these evidence-based responses are really implemented nationwide. In many settings, policies and school-based prevention programs exist, but they are not evidence-based and often ineffective. And there might be cases of that some policies and interventions may produce negative consequences, and in contrary to what's meant to. And also, it's very often found there is a lack of coordination between stakeholders involved in the national responses to substance use, particularly in relation to education. And in a number of countries, the education sector, especially the Ministry of Education, represented by the Ministry of Education and other education authorities, is not meaningfully involved in the national responses to substance use among children and young people for different reasons. For example, there is a lack of expertise or lack of resources as usual. So why there is such a gap exists? So of course, there are many issues, there are many challenges. And first, I think one of the issues may be that many of the best practices or evidence-based responses are developed maybe from the health sector, and which might not be fully adapted to the context of the education sector. And of course, there are many responses that are developed from the schools. There are so-called school-based responses. So they work very well in certain schools, but we can find it challenging to scale up from one school to many schools, from one province to nationwide, because we see that the school is actually a part of a very broad and complex system, as shown by this diagram. And the education sector system involves a large number of stakeholders and is made of a large number of components. And there's a complex set of linkages or interactions between the support level and implementation level. By implementation level, we mean where the programs are delivered, basically the schools and other educational institutions. And the support level, we mean by the, for example, the education authorities and the policies and the education infrastructures, etc. So this has actually important implications for planning and for considering the coverage and scaling up of evidence-based interventions nationwide or at a broader level. And also there are other kind of additional, in addition, there are a number of other factors to consider when working with and within the education sector. As you could see, some of the factors listed here in the slides, like the ministers of education, school principals, teachers, and under the scrutiny and pressure of very diverse constituencies who belong to different sectors from society and who should be accountable to them. And therefore, the education sector often tends to be relatively slow in implementing change. And also, there's the issue of level of centralization or decentralization. So the implementation of policies or guidelines is ultimately up to the educational personnel. So the personal values and the readiness or resistance to change and their capacities matters. So it's important to train all those who are involved in the delivery of the prevention programs. And in some countries, most educational institutions often have a de facto large autonomy in implementing policies and guidelines. And also there are all these elements do not always facilitate the adoption of evidence-based approaches, including contents and methods, especially those developed within a context of kind of pilot testing, very well-founded settings. So this applies substance use prevention education. And finally, if you could consider the education sector, the cycles of a program is different from the other sector, from what of the other sectors, which takes time to go through from the policies to ultimately to have the policies operationalized and finally delivered in the schools. It's a long process involving many steps, taken many years sometimes. So prevention planning in the context of the education sector with such characteristics and the checklist we just mentioned about requires careful consideration of all these characteristics and the constraints of the education sector to harness the resources and the opportunities of the sector in the national responses to substance use. So therefore, to us, we think an effective national education sector response to substance use among children and young people is a comprehensive response and should be a comprehensive response. And we have to move away from a focus on school-based interventions only and apply a holistic sector-wide approach to mobilize the various components of the sector and the many stakeholders that should be involved in that response. So this diagram, this jigsaw shows the different components of a comprehensive education sector response.
Excuse me, Yongfeng, you have 5 more minutes.
Yes. So this shows actually a conceptual framework of a comprehensive education sector response, which has been recognized or appreciated through a joint initiative by UNESCO, UNODC, and the WHO, which is an international consultation process on education sector responses to substance use. So it shows that, as just mentioned, we have to have a holistic view of the different components of this comprehensive response, which includes, as outlined by this graph. Firstly, the education sector policy and strategy framework that can take a number of forms, such as mandatory school substance policies, statutory health and substance use education, or provision of school health services, etc. And the second component mentions about national or subnational curricula that are usually and most appropriately accommodated in the health-related subjects area. And another component is the training and support of educational personnel and other school staff to ensure their capacity to deliver and support high-quality prevention program responses to substance use in schools. And next one is evidence-based responses at school level. So that includes so-called universal prevention approaches and selective education prevention approaches as some examples were given just in Hanna's presentation. And also, it's very important about the linkages between this education sector and the health sector for the provision of appropriate school health services. And finally, the effective management of the education sector responses requires effective, of course, management, coordination, and evaluation. So this framework, as I just mentioned, has been appreciated through the joint initiative by UNESCO, UNODC, and WHO. So this consultation process involved like the following phases as listed here. So we conducted a quite extensive literature review to consolidate existing evidence and data and literature, which result in a technical background paper, which are presented at an international expert meeting, so with additional input from the experts from different regions and different constituencies involved in the substance use prevention for children and young people. And the outcome or the output of this process is a joint publication by UNESCO, UNODC, and WHO. And I regret that this publication is now overdue. So finally, it will be available hopefully next month. Now it's being, we are having it being in the process of design and layout, and it will go through the clearance process by 3 agencies, and I hope it won't take too long to get it published. So this booklet, as Hanna just referred to as a guide, which is actually a booklet of a series published by UNESCO as a good policy and practice in health education series. So the publication will summarize data available on substance use among children and young people and provide the rationale for the role of the education sector and the school health services, and highlights approaches that have or have not been effective, which are mainly based on the evidence documented in the international standards Hanna just presented. So, and typically this booklet will contain practical guidance and examples or case studies from different countries and regions to show the approaches related to the different components of a comprehensive education sector response. So this is a table of contents of this booklet, which shows that it's all structured around the elements of a comprehensive education sector response, as I just mentioned. So that's it. Sorry, I might take more time for this presentation. Thank you.
Thank you, Yongfeng. This was also a very, very good and informative presentation. Let me just check. Are you all hearing me?
Yes.
Okay. Then I'll move over to, we have some interesting questions in the chat box already. We have a question from Mohini, which I've combined with a question from Sarah to Hanna about life skill approach. What are some of the key ways that we can think about teaching kids those life skills? Is a question from Sarah, and a question from Mohini Venkatesh, who says, are there ministries of education that you know of that are actually measuring life skills in children? I think it's a question to Hanna, but you might also refer to Yongfeng.
Thank you for the very interesting question. If I start with the life skills education, indeed it's a key, and like somebody has just stated in the comments, just say no is very detrimental often, because it places all the responsibility on individuals, whereas often the real causes of substance use are way beyond the control of the individual, because also our possibilities to learn those life skills are not always on our own control. But as I was mentioning in my presentation, the interactive programs that provide opportunities to practice very concrete techniques for relaxation, managing stress, recognizing emotions, communicating emotions, working in a group, solving problems, and so on and so forth, have shown effectiveness. But of course here the problem is that we are not yet in a point where we would be able to provide foolproof guidance in that sense, like you do A, B, and C, and then you get good results, because we have evidence of programs. If you implement program A, B, and C, then and do it with good fidelity, then you have these outcomes. And unfortunately, many of these programs are still also copyrighted and need to be adapted to your context and so on. So there are many, many important questions there and to tackle, even if there are also few programs like the Unplugged that are in open domain, and that has little bit, they are trying, for example, this Unplugged program, I know it a bit better because we are working with it. They are trying to generate data on the impact of the specific lessons and what happens if you leave one lesson out and so forth. But still, we are at the point in the process of accumulating evidence where we can only really say that these programs that all share the characteristics that they are interactive and build these core life skills are effective. And after that, I think then it's more to the practitioners to share their wisdom of the good ways to really make these programs work with the kids, which is a big set of skills to really engage the children in a nice and appreciating atmosphere. But when it comes to measuring life skills, we are constantly engaging in dialogue with our member states, including with people representing ministries of education, and trying to find out information on these kind of things like life skills. And I have to say that I cannot remember any case where somebody would have been able to present data on life skills. Of course, when they have a specific program like this, then they can present the pre and post data on life skills. But at national level and beyond, then I haven't seen that. But of course, WHO surveys, I'm sure there are others in this call who know them better by heart, but they have some questions that might point more to the direction of life skills.
Thank you, Hanna. I'll move over to next question from Doug. Thank you also, Doug, for putting in the chat box a bibliography that we can access by clicking on it. But his question was about whether you have info and statistics about substance abuse programs in low-resource countries specifically, maybe in the forthcoming publication or in other publications. And maybe that's more of a question to Yongfeng.
If I may start very quickly, and then I give it to Yongfeng, because that's a big issue that we are constantly also working on here. Because, for example, on the standards, I think 5% of the literature that we included in our evidence base when we did a systematic review was coming from low and middle income countries. And there is some evidence, but there is not nearly enough of evidence. And we are right now at this moment in a process to update these standards. And this is one of the big reasons why we want to update the standards, because we have just sent communication to all of our member states asking them to nominate experts and identify any possible research of evaluating these type of prevention programs in low and middle income countries. But most of the examples that we know of are adaptations of programs developed in Northern America or in Europe in middle income countries. But there are some, for example, in Southern Africa, they are doing excellent work. For example, on parenting skills, where they are aiming to develop an open domain parenting skill program. But most of the homegrown programs, unfortunately, do not have so strong evidence, but there is some. And also we make a point to list, for example, in our standards, whenever there is evidence emerging from from other continents and point out, for example, I think on school policies we had data on and research included from Asia and so on, but the examples are rare, and so that's very important question.
Thank you. I'll take one more last question, which is also from Mohini, which is about whether you're considering campaigns, media campaigns or social media campaigns as effective ways for prevention of substance abuse.
Thank you again for really nice question. Yes, we do consider them, and they are listed in the standards with the disclaimer that those campaigns need to be based on solid theories of persuasive communication and be evaluated and also be developed via formative research in a way that the messages are first properly tested among the specific targeted population groups before disseminating them widely, because I'm sure all of us have encountered too many examples of very expensive media campaigns yielding no results. We have good examples of very expensive campaigns with absolutely no results, but we do have also some examples of campaigns that have been successful, and so we are recommending them also because they can reach such a wide such a massive amount of people. So if you have good messages and you are targeting them strategically to the right groups, you can really have impact that registers at population level in the very best case. And just to mention a few examples, for example, there was a campaign in US that was targeting parents, telling them how they can be better parents and support their children so that they would not engage in substance use behavior. But the research found out that that campaign actually had very good direct impact on the youth, because apparently as the youth were seeing these messages, they didn't bother to counter-argue to those messages because they were anyway not targeting the children and the youth. They were targeting their parents, so they didn't bother to counter-argue. And as a result, apparently the messages were really sunken in. Or other cases in Britain, there have been, for example, many kinds of reality shows on parenting and how to improve your parenting practices. And we have encouraging data on that type of interventions. Or now, for example, they were just distributing leaflets in refugee camps on how to be a better parent and protect your children from the enormous stress. And I think that can be counted as media campaign because it was basically one leaflet in the package of bread that they were distributing, and the evaluations showed really promising outcomes. So these kind of things can work, but we need more good examples, and so we are hoping that those would be generated over time.
Yongfeng, do you want to have a last comment to any of those questions before we close?
Yeah, I think Hanna has already well covered the responses. I think it's good. I just mentioned the booklet we are producing with the UODC and WHO, mainly for the education sector to use they are the main targets. So it's mainly focused on the responses that the education sector can make within the context of the sector. So we didn't cover much on the responses such as social media campaign or campaign outside of schools. That was not prioritized in this booklet.
Right.
So, yeah, focused on the institutionalized responses that the education sector can make. Yeah.
Thank you, Yongfeng. That's an important note. So the forthcoming publication will focus specifically on the education sector, but obviously there are many other literature out there which covers other strategies of how to reach especially vulnerable youth and other populations that are vulnerable to substance abuse. Thank you both to both of our presenters for fantastic work that they've done to pull together this information in just 1 hour. We know it takes a lot more time to develop effective programs for substance abuse. I will close now by 2 remarks. This is the last of the webinar series of this year, 2016. Please look forward to the next webinar in February 2017. So we will take a break in December and January, as far as I understand, and we will let you know the role of topics for next year's webinars. And please also note that this Saturday is actually World Toilet Day, which is important for the school health and nutrition community. Thank you, everybody, for listening and joining us this morning or this evening or wherever you are. And have a nice day and end of the year.